right, slide 21. All right, so now frequently with pediatrics, some are geriatric patients, you're gonna have to figure out medications that are based on weight, okay? And we'll talk more about that in the actual PowerPoint. But let's put some of this to practice. So on slide 21, it says when an order is based on body weight of the client's typically going to be expressed in kilograms. We usually don't do things by pounds, and nursing, we do things by kilogram. So the order will probably indicate 5 milligrams per kilo, or 10 milligrams per kilo, or however many grams per kilogram. It's going to give you that specific information. And then that's your job to calculate the dose based on your client's weight. All right, so it says I have Dilantin, or phenytoin, 15 milligrams per kilo for a loading dose, and then 300 milligrams per day. So we need to figure out what our loading dose is going to be for our client. And our client is 80 kilograms, okay? So if our client is 80 kilograms, remember, I want to set this up to answer for milligrams, okay? So I need to set this up that my kilos will cancel out, okay? All right, so my client is 80 kilograms. Notice I didn't start with the dosage first, because I have to set it up to answer for what my question is asking me. And you're going to see more of this as we progress and get into some more difficult problems. So it's 80 kilograms, okay? That's what my client weighs. And the order is for 15 milligrams per kilo. So 1 kilogram, 15 milligrams, okay? So do my kilos cancel out? They absolutely do. Am I left with milligrams by themselves? Yes, I am. So I know I set that up correctly. 80 times 15 divided by 1, and your answer would be 1,200, okay? And I know, again, you could probably just do that in your head, but I encourage you to set this up with dimensional analysis. And as you go forward with some of your weight-based medications, a lot of times you can't figure those into the problem altogether at the same time. You need to get your dosage first before you actually build the rest of your program. I mean, your problem, excuse me. So we just always need to get that dosage first, if that's indicated. Okay.